From Re India. Good morning, I am Amit Wankhede from Re India News. Today I am at Hotel Centrepoint at Nagpur for the installation ceremony of Association of Physicians of India. I have a very renowned cardiologist from Hyderabad. From Kerala. Sorry, from Kerala. I have a very renowned. I have with me a very renowned cardiologist from Kerala. He came to Nagpur to attend this installation ceremony. So I welcome you to Nagpur and to Re India News.
Thank you so much.
Sir, I would request to give a short introduction to our viewers, sir.
Hello, Namaste, I am Dr. Sajan Ahmad. I am a senior consultant cardiologist from Kerala. I am here to attend the Vidarbha API meet where Dr. Deepak Bahekar is being crowned as the president of the Vidarbha chapter of Association of Physicians of India. I am accompanied by Dr. Nitin Vadaskar, who is the secretary for the year. It's been a great experience coming here. Nagpur, the city of oranges, and I would say the city of lovely people. Thank you so much for the invitation. And I think the scientific deliberations that we had during the conference was of excellent quality. And I think the most important thing is whatever information that we share in this scientific meetings will reach the people and would help to improve the care of the people of India. Thank you.
So, what were the issues which were discussed over here today?
We had a wide range of discussion on a lot of topics. We had a detailed presentation of a single center study about COVID by Dr. Deepak Bahekar's center in Gondia, and it was really an exciting work of more than 800 patients with COVID being treated during the peak of the pandemic.
860.
And yeah, correct, 860 patients. So it was a wonderful study which will definitely help us to formulate new plans so that we will be more prepared in future should such a calamity strike again. We had sessions on pre-diabetes, which is an important evolving area, and the measures that were taken, and we had presentations from many senior doctors and also from young postgraduate doctors from in and around Nagpur on various important disease processes. Then of course we also had a session with focus on cardiac issues affecting patients, especially myocardial infarction, which is now on the increase, especially among young people. So awareness needs to be increased at all levels, at the public level, at the doctors, at the physicians level, and such a meeting is of course of great importance, and I congratulate the API Vidarbha team for organizing this.
So, can you throw some light on pre-diabetes?
Yeah, of course, we had an entire session devoted to pre-diabetes, and even though it is not particularly a disease that was mentioned, I have the expert himself here. Sir, please join us.
Yeah.
Do I talk in English or Hindi?
Yeah, English. Because the
English
interview is
only.
going in
Okay,
English.
yeah. At the outset, I would like to thank this chapter, Vidarbha chapter, for inviting us here. The topic which was been given to me was there were different types of topics which has been discussed, including COVID, heart, and everything. The topic which was given to me was the pre-diabetes and its complications, the how to treat and how to prevent diabetes in day-to-day by doing day-to-day activities. Actually, nowadays the incidence of diabetes has increased like anything in India. It is said that India is the diabetes capital of the world. So we have got almost 60 million people who are suffering from diabetes in India. So the pre-diabetes is the early detection of diabetes when the patient has got yet to develop the diabetes, but the patient is likely to have diabetes. So how we diagnose this is because of his circumstances, whether there is a family history of diabetes, what is his weight, what is his age, what are his habits, whether he does exercise daily or not, what is his dietic habits. All these things are taken care of, and if the blood sugar levels, when we do in these patients at early stage, and if we found that his blood sugar levels postprandial after food is between 140 to 119 and fasting blood sugar in between 110 to 125, we label these patients to be a pre-diabetes. So then we'll ask a question, if the patient has got a pre-diabetes, are there any likely to develop complication, or whether he is likely to get reversed? He can be reversed only when if he follows certain norms. He has to do a daily exercise, he has to reduce his weight, he has to follow the diet, and in case he is very obese, we can give him some medicine like metformin, which is the drug of choice in such a type of patients. And if we treat such patients at early stage, we are going to prevent his complications, and he at least will see that he will develop diabetes in late stage. We can't say he will not develop diabetes, but there are chances that we may prolong his development of diabetes. Otherwise, he will develop early diabetes. So this is very important to detect the patient to have pre-diabetes, and it is mainly advice on the diet and exercise. So insistence is only on exercise and diet, which can help him to reverse his diabetes. Thank you very much.
Sir, now you are also with me, and a leading cardiologist from Kerala is also with me. I will ask a question to both of you. What's the connection between pre-diabetes, diabetes, and heart diseases? First,
Of course, diabetes.
this-
Diabetes is definitely one of the major risk factors for development of cardiac disease, and in various forms like coronary artery disease leading to heart attack, and also various forms of heart failure where the heart's function is also affected. So diabetes definitely should be detected early, should be treated appropriately to prevent heart disease. It's one of the major risk factors, along with the risk factors like high cholesterol levels, and also systemic hypertension or high blood pressure, and also smoking, along with various other risk factors.
what light can you throw?
No, basically even the patient has got pre-diabetes, and if you treat him early and if you ask him to reduce his weight, like he has said, avoid smoking, then he follow certain dietetic norms like lipid lowering, weight reduction of weight. If you all these things are do, he will prevent from diabetes. But it is said that diabetes can create different type of complications.
Mother of all diseases.
Yes, it is a mother of all diseases. It can create the macro and microvascular complications, which we label it as. Macrovascular complication, as he has said, is the patient may develop heart attacks. But if the diabetes is well controlled, if you reduce the weight, if you have got doing a regular exercise, the diabetic man can live life like a normal man. If his sugar levels are normal, if he is well controlled. But if he is not well controlled, he is going, even fluctuations in sugar levels is also bad. So many times what happens, no patient takes medicine for 2-3 days, and after 3-4 days he comes to doctor. That time if we see his sugar levels are normal. But for that purpose, if we investigate him through other parameters, we see that he is not regular in taking treatment. So ups and downs are very bad. Ups and downs in sugar levels are very bad. It may create more complications. So better is to have a better control, better lifestyle, daily exercise, reduce your weight, avoid smoking. If you do all these things, I think, and sleep early. Don't sleep late. You should have food at early, and then only you can prevent diabetes. You can if you have got a diabetes, you can prevent complications at least. Thank you.
So, we Indians are a very good arguer. Last time also this was discussed in this same hall by Dr. Khobra Gade. Sunil Gupta. The patient has one symptom and he doesn't have the other symptom of diabetes. So, he argues with the doctor that I don't have a diabetes. What would you like to say?
Basically, we have seen in diabetes and hypertension, if the patient comes to you, so many times patient is symptomless.
Yeah.
Even he don't have one symptom also. But when you do his regular checkup, we see that his sugar levels are very high. But even it is very difficult for us to convince him that you have got a diabetes. He says, I don't have any problem. How you are saying that I have got a diabetes? But he is always in a denial mode. So if he is in a denial mode, it is a duty of the doctor who has to convince him that you have got a disease and you have to take a treatment. And if you take the treatment, you will be all right. You will be like me and not like a normal man. So that part is very important. And patients, even I have seen a patient whose blood pressure is 240. If his blood pressure is 240, still he don't have any symptoms. So that doesn't mean that he should not take a treatment. He has to take a treatment, he has to control it, he has to modify his lifestyle, he has to modify his diet, he has to take a regular medicines. If he take all these medicines, he can be like a normal man.
Sir, my last question. If you want to say something to a diabetic patient in 1 or 2 lines, what would you like to say?
If you are diabetic, take a proper treatment, modify your lifestyle, follow the diet, and if you follow these things, I think you are like a normal man like others. Thank you.
Sir, thank you very much for talking with Re India News, for sparing your valuable time.